Okay, hi everyone, my name is Manasi. So I'm going to be presenting about if we should continue to be using dental amalgam, otherwise known as silver amalgam, and if we have good enough alternatives for it. So, what is silver amalgam? Silver amalgam is one of the most common fillings for patients above the age of 15 to 16, as it bonds directly to the tooth, so it's very durable, and in line with its cost, it's really cost effective because it can last up to 15 years. Also, the process of applying this, of filling the silver amalgam is called amalgamation, and that is also not a very time-consuming process. Um, but it has got poor aesthetics. As you can see, it ruins the look of the teeth, so it doesn't look very natural. Because it is a metal alloy, it also has the risk of corroding over time. Moreover, when filling the tooth, a lot of the healthy tooth tissue also needs to be drilled out in order to make enough space for the filling to be put in. And one of the last main disadvantages is probably the most notorious, and it's that it has been flagged because there is a risk of mercury poisoning. So, what are the possible dangers to people? So, there have been concerns over exposing the patient and the dentist to mercury or mercury gas, which can in turn cause mercury poisoning. As of now, there is no safe level of mercury that we can be exposed to, and in the case that you are subjected to further decay on a filled tooth, and the filling has to be removed for any particular reason, both you and your dentist can be directly exposed to mercury gas. And it has also been reported that small amounts of the filling can be ingested over time, which in turn, obviously, you're directly bringing mercury into your system. Drinking things that are too hot can also encourage mercury vapor to be released into your mouth. So amalgam fillings don't have any clear scientific evidence that links their use to harmful health effects, which is why we haven't seen too much about its continual use and why it still hasn't been banned in the UK. But small doses over a period of time can be harmful, and because of that, any spillages with amalgam in a clinic need to be reported. And exposure to mercury can result in neurological and behavioral disorders. So that can include tremors, insomnia, memory loss, cognitive dysfunction. So it can affect a lot of different parts of your body. Apart from just yourself, it can also endanger the environment. So if waste amalgam isn't disposed of correctly, it can fill up in landfills, sewage sludge, and it can leach into the external environment, which in turn affects biodiversity. If the wastewater that is taken from dental clinics goes into open water and without being treated correctly, it can affect the organisms living in the water. So one of the most biggest problems with mercury in water is bioaccumulation, which means that, so for example, fish and other organisms living in the water will ingest the mercury, and then that will move up the food chain, and it can also eventually get to humans as well. So bioaccumulation, it's one of the biggest threats of exposing mercury in our environment, because it's not only the organisms that directly live in the water who get affected, but it's also the other animals who end up consuming those organisms, humans, because because the mercury in the environment can also affect plants. If vaporized, sorry, I'm repeating myself, but so that's just bioaccumulation if mercury directly goes into water bodies, but vaporized mercury, so mercury gas, can also dissolve in rainwater, which then affects crops and etc. So regulations regarding the use of amalgam. So after everything I've said about how amalgam can affect the environment and us, it's quite shocking. It could be quite shocking that the UK still hasn't done anything regarding it. So the European Court has banned its use as of the 1st of January 2025, but So this applies to any countries living in the European Union, but this ban has been extended to the 30th of June 2026, which will allow EU countries to adapt their healthcare systems to use alternatives instead of dental amalgam. So up until then, they will still be able to import amalgam and use it. So the UK doesn't have any specific bans on it, but there are a lot of regulations in line with it. So it must be used in pre-dosed encapsulated form. Pre-dosed encapsulated form, which means that it can't be used in bulk, and it shouldn't be used in children under 15 or pregnant and breastfeeding women. And finally, practices must be equipped with an amalgam separator. And what that basically is, it's a device that's designed to trap any amalgam that's in the wastewater of the clinic, which will then prevent it from, leaching into sewage and etc. And these amalgam separators need to at least trap 95% of the amalgam that is in the wastewater. I've also mentioned previously how the removal of amalgam fillings can expose both the patient and the dentist to mercury gas. So one regulation that the BDA has put in is that PPE, which is personal protective equipment, must always be worn by the dentist that is performing the filling and the removal. Any amalgam waste or unused cartridges also need to be disposed of in a lidded container, and that specifically goes to an amalgam recycling centre which processes it. So what alternatives do we have? So there's quite a few alternatives, but I wanted to focus on composite fillings and glass ionomer fillings. Composite fillings are another really common filling, so I wanted to address that. And then glass ionomer is something that I hadn't really heard before, and I came across it while I was making this presentation, so I thought it'd be interesting to talk about. So composite fillings. So composite fillings are a mixture of plastic resin that's reinforced with powdered glass filler, and it can be used for multiple different dental restorations like fillings, veneers, etc. And a good thing about this filling is, unlike amalgam, which change the aesthetics of your teeth, it has good aesthetics for your teeth because they can shade the composite filling to match the color of your teeth, so it's not noticeable. Advantages, compared to amalgam, it also requires very little removal of tooth tissue. It bonds directly to the tooth and hardens immediately after it's cured. Disadvantages is that one of the main ones is that these fillings can shrink once they're set, which basically means that if there's any gaps between the filling and the tooth, there can be decay between those, and then the tooth will become more infected. The filling can also fall out, and if this isn't caught as soon as it happens, that can subject the tooth with the filling to further decay and discoloration over time. Okay, then we have glass ionomer fillings. These are made of glass fillers, and essentially it's this flexible paste that makes a seal between the internal tooth and the surrounding environment, so it protects the tooth from further decay. The material is a really good sealant, so besides fillings, it's also used in orthodontics, so it's used to place brackets onto teeth for braces. Again, it's less obtrusive than an amalgam filling, and one interesting thing about this is that the silicate glass filler that makes up this filling also contains fluoride, which means that fluoride is released with the filling, and it can prevent further tooth decay, which means that even though this isn't as long lasting, so for example in adults it can only be used temporarily, so it can only last up to maybe 5 years maximum. So it's really good for children, especially if they have any decay in their baby teeth, which means that they're able to stop the decay from progressing, but also prevent any they're able to prevent any further decay from happening on the baby teeth, and because it's not too long lasting, it means that they're not having to use anything that could potentially harm the patient. So what is the conclusion? So as of now, there is no filling material that can compete at an equal ground to the performance of dental amalgam in line with its durability, how cost effective it is. But just because of that, we can't really ignore the problems that have been arising because of the use of amalgam. So hopefully we can get to a time where we have an alternative for amalgam that is cost effective and doesn't carry the danger of causing things like motor dysfunction. Thank you. Oh, yeah.